First off, I'd like to thank you for joining our presentation today. My name is Jennifer Hope, and I am the Affiliate Marketing Advisor at ARTA. And we also have Gary Sawatsky here with us today, and he is our Chief Operating Officer. We're going to give you a little bit of a brief overview of what ARTA is, what you get when you become an ARTA member. And also we're going to talk about the Retiree Benefits Plan and all the options available to you and some exciting changes that we have happening within our organization. Just a couple presentation notes. This session is being recorded, which is why we've enabled your video as well as your microphone. If you have any questions, please use the Q&A box and we will answer your questions as the presentation goes on, either Gary or myself, rather than using the chat box. After this presentation is finished, I will upload it on the ARTA YouTube channel. So if you want to go back and re-listen, or if you have any questions, they could be answered through the presentation, go for it. It's the ARTA YouTube channel. After this presentation, if you want to email me, I can mail you an enrollment kit. And within this enrollment kit, it has, it's a really great booklet on some retirement advice, everything about ARTA, and it also has our plan summary and our application forms. So I can mail that to you this week. So just email me your mailing address and I'll be happy to send you one of these kits in the mail. All of this information is also available on our website at arta.net, and I'll share the landing page with you later on in this presentation. So we'll get started. So a little bit about ARTA. The Alberta Retired Teachers Association was founded in 1963. We are a provincial association which was created by retired teachers. However, throughout the years, we have expanded and included different public sector groups such as yourselves and some private sector groups. We have been the sponsor of our group benefits plan since 1995. And just this past January, we started self-administrating our retiree benefits plan. So now everything runs under one roof. We run our retiree benefits plan as well as our membership. So it's a one-stop shop. You don't have to go to different places to learn about your retiree benefits or apply. It's just all done through ARTA now. We have over 26,000 members and we're always growing. We have 18 branches located throughout Alberta, and our branches are sort of a place where our members can meet and have different breakfasts. A bunch of our branches also run different conferences, which you're able to join. All of our branches are located in Alberta, except for one, which is located in BC, because we know a lot of our members like to get out of these sub-zero temperatures in Alberta and enjoy the warm, hot sun in BC. Our provincial office is located in Edmonton. We recently just moved into a 30,000 square foot building where 3 people are able to be in there at once for COVID safety. But once we're able to open our doors safely, members can come in and they can make meetings with our member services team where they can ask different questions about applying to ARTA, or answer different questions they have about the retiree benefits plan. Eventually you'll be able to schedule meetings with our member services team, and they'll be able to answer any questions that you might have. So one day we'll be able to get into our beautiful building and meet together again. So when we are able to meet again, we do have 6 committees, and our 6 committees meet at ARTA, and they help ARTA, reach our goals, make some important decisions on health benefits, governance, wellness, strategic planning and advocacy, our communications, and our pension and financial wellness. So these are all of our committees in ARTA. They are comprised of retired teachers, and they just help us achieve all of our goals. So there is an annual fee to becoming an ARTA member. As UNA members, you are considered affiliate members. So it is $50 a year. And if you take part in our retiree benefits plan, We just add $4.17 onto your monthly premiums, and your membership is taken care of that way. So why join ARTA? What's in it for you? Well, there are a number of reasons why people do join ARTA, but the number one reason people do join ARTA is for our ARTA Retiree Benefits Plan. Joining the ARTA Retiree Benefits Plan gets you one of the best retiree benefits plans there are in Canada. We offer comprehensive coverage on health, dental, and travel. And Gary is going to speak to our retiree benefits plan in detail in some upcoming slides. But aside from the retiree benefits plan, there are some really great programs that we offer to our members. Being our member discounts program. We have our Boom discount program, and our Boom discount programs offer some really great discounts on car rentals, hotel rentals, various retail outlets. There's different gym programs on there. We also have some partnerships with Calgary and Edmonton recreation facilities where you can receive some discounts on your gym membership, your pool memberships. We also have partnerships with the Calgary Flames and the Edmonton Oilers, which provide you cheaper tickets to go see the games. And now we can finally get into the stadiums and go to the game safely. So it'd be nice to go see a game. We also have our charitable foundation, which we're really proud of. So our charitable foundation, it supports all Alberta seniors in finding appropriate housing, different wellness initiatives. We volunteer at Operation Friendship every year, and the ARTA team provides a hot lunch to different seniors that may be in need. So our charitable foundation is, a way for us to give back to seniors that may need a little bit of help. We've made sizable donations to the CNIB, the Alzheimer's Society, as well as the Parkinson's Association. So wellness is one of our strategic goals within ARTA, and we support that goal in a couple of ways throughout the year. We have an annual walking challenge where members can record their steps or their time spent doing a physical activity, and they receive different prizes, and their names published in our News and Views magazine. We have a photo contest where members submit their work to ARTA, and they receive their work framed and receive some various prizes, and their work is also published in News and Views. We have a writing contest where our members submit their work for fiction, non-fiction, poetry. We even had a cartooning category. So there's different ways that we involve our members to, stay well. We also have mental wellness games too, where members can participate. We have a really great scholarship program for our members. So any direct relatives, so children, grandchildren, nieces or nephews are able to apply to our scholarships. We have a degree as well as a diploma program where people can enter their scholarship information. And we award $40,000 a year to our various recipients. We also have an ARTA apparel store where you can purchase some really great clothing at really cheap prices. So just artaapparelstore.net. We have some really great partners that also offer our members some discounts. Our insurance partner, TW Insurance, they offer some really great discounts on home and auto insurance. We've had members that save on average $400 a year on their home and auto. So you can just give them a call, get a quote, and see where you can save on your home and auto insurance. They also offer some life insurance programs geared towards our members. And as you have a retirement coming up, I'm sure you're looking forward to traveling at any time in the year that you would like. We have some travel partners, Colette and Merit Travel, and they can help you organize your trip. They can give you some advice, and they also offer some discounts on various travel tours. So we also like to communicate to our members in a variety of ways. We have our News and Views magazine, which is sent out to our members every season. Our News and News and Views magazine is something that we're really proud of. We have a variety of articles within this News and Views magazine pertaining to our members. It gives all information about ARTA, anything that's going on in our branches, different wellness articles, gardening, physical wellness, travel. It's just a really great magazine, and I know our members really enjoy getting it every season. We also provide an Artifacts email newsletter to our members every month that just gives them updates on ARTA, anything that's going on with your retiree benefits plan. Sometimes our members, they also like to advertise in Artifacts for different vacation rentals that they have to offer. Again, our website is also a wealth of information, arta.net, and we are active on Facebook, Instagram, YouTube, and LinkedIn. So we make sure that we communicate to our members in a variety of ways so you always know what's going on with your retiree benefits plan and what's going on at ARTA. So a bit of a background on the ARTA Retiree Benefits Plan. The plan was created by a group of retired teachers who wanted to create a benefits plan that was more conducive to a retired teacher's lifestyle that included emergency travel, as we know that retirees love to travel and finally go visit those places that you've always wanted to. ARTA is a not-for-profit organization, meaning all premiums or any monies that come into the organization go to keeping our retiree benefits plan the best that we can, offer as much services as we can, as well as keep the premiums as low as possible. We have not increased our base extended healthcare premiums in 9 years. So we're really proud about that. A lot of different benefits plans, they'll offer discounts if you sign up at a certain time. We are unable to offer any discounts because we don't have any profit margins built into our retiree benefits plan because we're a not-for-profit organization. Our travel coverage is very unique and very competitive. It is definitely one of the best plans that you can get in Canada. We do not have any pre-existing conditions or stability clauses built into our plans. Gary is going to go through that in more detail once the travel slides and travel insurance slides come up. So the travel coverage is something that is unique to most retiree benefits plan in Canada. Our over 65 plans are designed to complement the Alberta Seniors Drug Plan. And once again, Gary will talk about that a little bit further, but there are prescription drug maximums within our over 65 plans, and that is because it is built to complement the Alberta Seniors Drug Plan. So joining ARTA is easy. However, there are some eligibility requirements that you must meet in order to join our plans. So for your group, a retired UNA member who has been a UNA member for at least 2 years, you would be eligible to join our plan. You must be a member of ARTA. So that $50 a year gets you membership into ARTA, as well as all the additional fun things that I talked about. Another unique piece about ARTA Retiree Benefits Plan is that there is no termination age. You can join all until you're 104 years old. Our oldest member is 104 years old. I just checked that. So you can stay on for as long as you want. A lot of different plans, they do terminate at age 80 or even earlier. So when you're in ARTA, you're in forever. So that's a really great benefit of joining ARTA. Your spouse is able to join as a dependent onto your retiree benefits plan. And if anything were to happen to you, your spouse is able to continue on with ARTA. Again, that's something unique. And you must be a Canadian resident and covered by your provincial or territorial health care within your province. So the Alberta Seniors Health Plan, or BC, the BC Fair Pharmacare Plan. So if you're thinking about retiring and you would like to retire and you would like to join ARTA, we always suggest that you get your ARTA application form in about 6 weeks before retiring. Then we can make sure all of your information is correct on your application form, and if we needed to adjust anything, we can. So once your benefits end with your employment, we can start your retiree benefits that day. We have no lapse in coverage. The day you indicate that your coverage with your employer is ending is the day your ARTA retiree benefits would start. But it is really important, if you would like to take part in any of our plans that offer travel, you must apply within 60 days of losing your group benefits. Because if you apply to one of our plans that offer travel outside of that 60-day window, you would be subject to a medical questionnaire. And depending on how your health is, you may be rejected to receive travel coverage. So it's really important to apply within that 60-day window so you don't have to fill out a medical questionnaire. So if you decide to retire and your spouse is still receiving group benefits through their employer and you want to stay on with their group benefits, you are able to do so. But once your spouse loses those group benefits, you still must remember to apply within that 60 days. Or sometimes people like to get a different employment after they retire and that employer offers group benefits. Take their group benefits, but again, you must apply within 60 days of losing those group benefits. So my suggestion to you is if you would like to become an ARTA member and take part in the retiree benefits plan, get your application in about 6 weeks before. And once 2 weeks before your benefits start, you'll receive a welcome package from ARTA in your email, or if you choose to by mail, you'll get your ARTA number and some information on how to get started on your retiree benefits plan. I'm going to pass it on to Gary, and he is going to go through our benefits plans that we offer.
Thank you, Jen. We are making a number of changes at ARTA. We have noticed that our plan has been designed up to this point for people age 65 and over, but not everybody waits until age 65 to retire. And we've had a demand for more appropriate coverage for people under age 65 who do not yet have that coverage for seniors plan offered through the Alberta Healthcare Plan for Seniors. The first plan we're going to talk to you about is one which actually lets you get around those rules for the 60-day application window. This plan is called Primary Health. It's designed for people who are not coming off of a group plan, who do not want to submit medical evidence of insurability, and who want some base coverage under their group benefits plan. The Primary Health is an entry-level plan. It doesn't have very high maximums for prescription drugs or vision care, for example, and it does have limited emergency travel. The emergency travel is not nearly as good as the travel within our other plans. It only provides 15 days per trip and does include a stability clause. This is the only plan we have with a stability clause for our travel insurance, but it is there in case you need it. So if you retired today and say 1 year after today, you want to join ARTA, you wish you had signed up for ARTA when you were retired, but you didn't think you were going to need any coverage, but something has happened in your life and now you need coverage. You can join this plan without medical evidence of insurability, as long as you qualify as a retiree, you satisfied those eligibility requirements that Jen went over. You can join this plan and get coverage right away. Once you are covered under this plan for at least 3 years, you can upgrade your coverage to one of our other plans, one of our more comprehensive plans. And Jen, if you wouldn't mind moving to the next slide. These are the comprehensive plans for people who have retired prior to age 65. Now, you don't have to take one of these plans. You can still take one of our over 65 plans if it makes more sense for you, given your situation. But if you do want a little bit better coverage, this is the right plan for you. We have 3 different plan designs, so you can pick the level of coverage which makes the most sense for you and any eligible dependents that you have. So you can see the prescription drug coverage is a little bit higher than we would normally provide. We have good vision care coverage up to $500 every 24 months, plus hearing aid coverage available up to $1,100 every 36 months. We have a combined paramedical practitioner maximum. That means that we don't have a per practitioner maximum. So if you wanted to spend all of your annual paramedical practitioner maximum on massages, for example, you can do that, recognizing you wouldn't have any money left over for, say, chiropractor or physiotherapist. If you wanted to go to every single one of the practitioners that we cover once per year, you can do that too. That's entirely up to you. And this includes our full emergency travel coverage. That provides 92 days per trip with no pre-existing conditions clause and no stability clauses. And I'll talk quite a bit more about our emergency travel coverage in a moment. Each of these plans also includes automatically dental care plans. So depending on the level of coverage you select, you're also going to get dental care coverage. And that goes everywhere from the primary health with base 70% coverage up to $750 per year, up to the Cadillac plan, the enhanced health with 80% coverage for basic and minor restorative, 50% coverage for major, 50% coverage for orthodontics up to $2,000 lifetime with an overall maximum of $2,000. So you can select the level of coverage which makes the most sense for you. And then we have our over 65 plans. Again, you don't have to be age 65 to take it, but these were designed more for people who are age 65 and over and who are likely residing in Alberta, as you would have coverage with the Alberta Healthcare Plan for Seniors coverage. And about that coverage, in case you're not familiar with it, if you are a resident of Alberta, you will automatically get coverage through this plan. You are entitled to it. You may have to fill out some forms proving that you are turning age 65. The Alberta Healthcare Insurance Plan will send you those forms anywhere between 3 to 6 months prior to you turning age 65, if they do not already have proof of your age on file. They'll send you a new drug card showing that you have coverage through the Alberta Healthcare Plan for Seniors and the Alberta Seniors Drug Plan. The plan covers you for 70% of eligible prescription drugs. Those drugs are listed on the Alberta Drug Benefit List. You cover the other 30% out of pocket up to a maximum $25 per script. If you have ARTA coverage as well, we will cover that $25. So you will effectively get 100% coverage for drugs listed in the Alberta Drug Benefit List. Now that list includes about 3,800 or 3,900 medications. It changes every month. Out of about 8,000 medications available in the marketplace. If you are prescribed a drug not listed in the Alberta Drug Benefit List, we will cover it at 80%. We like to provide choices, as you've seen, within our extended healthcare plan. And so we've designed 4 different extended healthcare plans from which you can choose. 2 of the plans do not include any emergency travel, and 2 of the plans do include the 92-day base emergency travel plan. I can tell you that 88% of our members are covered under either total health or ultimate health, because they want access to that emergency travel coverage. Once you select the level of coverage that makes the most sense for you, you then select your annual prescription drug coverage maximum, either $1,200 per person per year or $2,000 per person per year. As you can see, that doesn't look like a lot of money, but keep in mind, we are typically second payer for the most popular prescription drugs. And you can make that $1,200 or $2,000 go pretty far when you're only paying $25 per script, say for maintenance medications that you get every 3 months. The $1,200 is actually appropriate for most people. last year, 93.5% of our members who made a drug claim had less than $1,200 of claims per that year. So, and less than 1% of people actually reached the $2,000 prescription drug maximum. So those are appropriate maximums for our members age 65 and over. Next slide, please, Jen. We cover 80% of eligible expenses. We do have a combined annual maximum of $10,000 per calendar year. Not very many people hit that $10,000 maximum, but it is possible. If you got a $5,000 wheelchair, $2,000 in drugs, $1,200 paramedical practitioners, a $2,000 CPAP machine, it could all add up in 1 year, but the likelihood that you're going to make all of those claims in 1 year is not very likely. You're probably going to spread out some of those claims from year to year. You can see the paramedical practitioners services that we provide. We have a combined annual maximum for those services. So as I mentioned, if you wanted to spend your entire annual maximum on one of those practitioners, that is up to you, or you can spread it out a little bit. On average, our members use 1.5 practitioners per year. We have a member assistance program. This is actually just starting up on November 1st. It's important, especially with what we see going on right now with COVID. Our members are looking for somebody to talk to, work through any issues that they're having, separation anxiety, things like that. And we know that there's a demand for a member assistance program for our members. And so we're adding that to our list of services provided to everybody who has an extended healthcare plan with ARTA starting November 1st. And the differences between those other plans. I told you 2 of the plans have travel, 2 do not have travel. 2 are more base or core extended healthcare plans, while 2 provide higher maximums compared to the others. If you were to take the HealthWise Plus or Ultimate Health, your vision care maximum would increase from $425 up to $550 per year. Hearing aids, starting November 1st, we're bumping up our maximums up to $1,300 under the core plans and $1,500 every 3 years under the enhanced plans. Paramedical practitioners, $1,200 per calendar year combined under the core plans and $1,400 per year under the enhanced plans. And we also offer some lifestyle prescription drug coverage under those enhanced plans. 50% coverage up to $150 per year for hair loss and erectile dysfunction medications. If you, I should also mention, if you decide that you are going to sign up for total health, for example, and then once you've been covered for a little while, you wish you had taken ultimate health, you can bump up your coverage at any time. You just need to let us know in writing and we can improve your coverage. The only caveat is that you are then locked in for 24 months before you can move your coverage level back down. So you have to keep that in mind. I usually tell people, take the total health. It's appropriate in most cases. If you find you are making vision care and hearing aid claims, it might make sense for you to move up to the ultimate health. But keep in mind, you are required to stay at that level for 24 months before you can move your coverage level back down. Thank you. And all of the extended healthcare plans we provide includes those items for which you are most likely currently covered for, plus some others that you are probably not covered for because they are designed specifically for people age 65 and over. Things like a power chair lifts. So a chair that actually helps you get to your feet in case you have trouble getting yourself out of a chair. Mobility scooters are covered under this plan. They're not always covered. Health education programs. We cover up to $100 per year for a physician prescribed education program for things like diabetes clinics or cardiac clinics. We also cover vaccines. That's a big one. That's our number 2 claim for prescription drugs right now is the shingles vaccination, Shingrix. We cover those costs as well. Now, our emergency travel plan, I can say without a doubt, is the best emergency travel plan available to retirees in Canada. We cover 100% of eligible expenses up to a $5 million lifetime maximum. The $5 million is a little bit of a red herring. The highest claim that we have ever had has been $840,000. So that person's nowhere near the $5 million lifetime maximum, but we have to have a lifetime maximum. So we were at the $5 million limit. We will cover every trip you take over the course of a year up to 92 days per trip. And the reset for that 92 days is immediate. That means that all you need to do to reset your travel clock is to return to your province of residence, prove that you were back in your province of residence. So I usually recommend to people, you and your spouse, if your spouse is also covered under this plan, each buy a cup of coffee with a credit card, something identifying you. As long as you can prove that you were back within your province of residence, you can then take off on another 92-day trip. For some of our Snowbird members, they will actually get in their cars on day 91. They'll drive back up north, across the border, typically into Alberta or British Columbia, buy a cup of coffee, and then drive back down south. Some of our other members say, I don't want to be stuck in a car for a day and a half traveling back to my province of residence. They will watch for seat sales. They'll get on a plane and they will return likely to either Calgary or Vancouver, depending on where they live, land at the airport and then take off on the very next plane. As long as they keep their boarding pass, proving that they were on that plane and returned back to their province of residence, they can go back for another 3 months. For people who don't want to do that, because that can be a bit of a pain, we offer supplementary travel insurance as well. Up to 212 days is available in 15-day units. If you end up returning home early, any of those unused 15-day unit premiums will be returned to you. So that means, for example, if you were going to go south for up to 122 days. So you bought two 15-day units, but you end up returning home on day 100. You've already used a portion of the first 15 days, so that premium is paid, but you haven't used any of the second 15-day unit, so we will return all of those premiums back to you. I always tell people, get it in case you think you're going to need it. It's better to have it and not need it than need it and not have it. The reason for that is you can call us if you are, say, on a beach in Mexico, it's 40 degrees below zero back home. You really don't want to be returning home. You can call us and we can add it over the phone. The caveat being, we will have to contact our travel insurance provider, Allianz, and ask if you have any claims for that current trip on file. If you do, they may want you to return home to get checked out by your family physician. And so they may deny adding that coverage at that time. If you don't have any claims, we'll be able to add those units for you. However, if you are calling us and it's past the 92-day maximum trip duration, you no longer have coverage and we cannot add those supplementary travel days for you. The other unique thing about our plan is we have trip cancellation, interruption, and delay insurance built in. So you don't have to buy it separately from your travel provider or through another insurance company. We'll cover you up to $10,000 per person per incident. We have no deductible and we have no pre-existing conditions clause or stability clause. If you are not familiar with what those are, a stability clause says that for any pre-existing condition, if it is not stable in the 90 days leading up to your trip, you are not going to be covered for it while you are on your trip. Or if you talked to your doctor about something, if you talk to your doctor within the 90 days prior to your trip, you're not going to be covered for whatever you talk to your doctor about while you are on your trip. Or if your prescription's changed, even if your dosage decreased because you're feeling better, anything associated with that medication is not going to be covered while you are on your trip. This results in some people avoiding going to their doctor and not looking after changes to their health care, which we believe does not make sense. We are not going to penalize you for looking after your health and visiting with your doctor. We would encourage you to go to your doctor. Ask if you are feeling well enough to travel. If your doctor says, I don't like the looks of what some of these things that you're telling me, or if the doctor says, I'm going to send you for more tests, then you have your answer. Cancel your trip, get your money back because you automatically have trip cancellation built in and you can travel without any issue. Thanks, Jen. Next slide. We also offer dental care plans under the build your own plan design, but these are separate. So unlike the under 65 plans, these are completely optional and can be added on if you want them, but you don't have to take them. We offer 3 choices for coverage under dental care as well. Option A is the most comprehensive plan, 80% coverage for basic and preventative with no annual maximum for those services, 80% coverage for minor restorative, typically root canals, up to $750 per year, and 50% coverage for major restorative, so crowns, implants, bridges, and dentures, up to $1,600 per year. Option B is the same as option A, but does not include any major services coverage. And option C is the same as option B, but only covers 65% instead of 80%. There is a minimum 2-year participation requirement for dental care. It is optional, but if you do take that option, you have to participate in it for 24 months. And the same rules apply for upgrading coverage. So you can move from option B to option A or even option C to option A, but you are then locked in for 24 months at that coverage level before you can reduce your coverage or terminate your coverage. And we're really excited about a new plan that we have coming up. ARTA's benefits plan is opening its own pharmacy. So Jen mentioned we have a nice big office, 30,000 square feet. About 8,000 of those square feet are being dedicated to our own pharmacy. It's going to be opening January 1st, and we are going to have special plans designed for people who are using ARTA RX to get their maintenance medications. It is only provided for residents of Alberta. You have to be a resident of Alberta because of licensing issues. But if you are living in Alberta, you can use ARTA RX and we will ship your medications to you, and your coverage level increases if you have ARTA RX coverage. If you use ARTA RX, you'll get 100% coverage for your prescription drugs and 80% coverage for lifestyle drugs. We're also adding another drug category to those lifestyle drugs. I already mentioned the hair loss on ED medications. We're also providing for weight loss medications under ARTA RX, and it would all fall under the combined maximum for prescription drugs, which is $2,500 for people participating in ARTA RX. So it's something we're really excited about. The rates are very competitive. They're essentially, the coverage is a little bit better than our ultimate health plan, but the rates, the monthly premiums, are a little bit less than the total health plans. So it's something I think a lot of our members are going to participate in, and it's going to be a great benefit for our members. So that's coming January 1st. So things to remember, you've obviously started to think about retiring, and you are no doubt getting a lot of information, perhaps too much information. So here are some things to remember when talking about your benefits plan and joining ARTA. First thing, ongoing eligibility. You must apply within 60 days of losing group benefits coverage if you want to participate in one of our comprehensive or build your own plans, which include emergency travel. You could take that primary healthcare coverage, but its coverage level is not as good as some of the other plans and has very limited emergency travel coverage. You can move from the comprehensive plan to a build your own plan once you turn age 65. The comprehensive plans do terminate at age 65, so we encourage you to move to one of the build your own plans. However, you don't have to take one of the under 65 plans. You could take one of the build your own plans if you want to do so. You could also take one of the ARTA RX plans if you want to do so. The primary and comprehensive plans have embedded dental, whereas they are available standalone with the build your own plans. Jen went through several other benefits for ARTA members, such as the Boom discount program, in addition to the benefits plan. So you're getting a lot of bang for your buck when you are joining ARTA. You get to participate in the benefits plan, plus you get the all of the entitlements that all of the other ARTA members get as well. If you want more information, if you want to see the plan summary for more detailed coverage information, as well as rate sheets which apply to you, they are available right now at arta.net/2021 plan summary. If you have questions that you think of after this presentation, you can give us a call at 855-444-2782. And all of the information is available as well on our website, arta.net. And finally, a lot of the information that you're getting when you're looking at retirement is like drinking from a fire hose. So make wise choices going forward. So with that, I'll turn it over to any questions. I'll turn it over to Jen to talk about the landing page.
Yeah, thanks, Gary. So we have a dedicated landing page for UNA members. So it's the page where you did sign up for this webinar, but we'll always have a dedicated web page for UNA members. This is where you'll find all the up-to-date information on plan summaries and rate sheets or any changes that are happening. So arta.net/UNA is kind of the place for you guys to find all of your information. And if you think of any questions after this presentation, feel free to email me and I'll be happy to answer them for you. Or if you want one of these fancy enrollment kits, just email me your mailing address and I will get one out to you this week. But that's all that we had for you today. So if you have any questions in the next couple minutes, please pop them up in the Q&A box. If not, I want to thank you for joining us today and letting us talk to you a little bit about what you receive when you become an ARTA member.
Thanks, everyone.
Thank you.
Okay, I see a question. So it's a nurse married to a teacher, not uncommon. So if your husband or you're married to a teacher, if the teacher husband is going to remain with ASCBP, most likely they're covered for ASCBP, my advice to you would be to stay as an eligible dependent under that plan. And then once that plan terminates, you would most likely both qualify as long as your husband contributed to ATRF for at least 5 years. They could join ARTA as a regular member and join the benefits plan and have you as a covered eligible spouse under that plan. So you would duly qualify, but my advice is stay under that group plan for the time being and only join ARTA once that plan terminates. If your husband retires prior to age 65, then I would certainly look to recommend considering that under 65 plan available to ARTA. My pleasure.
Okay, well, if